Hi, it's Cecily with Revival Nutrition and Health. I was super inspired today to hop on and just talk to you guys really quickly about this topic. It seems to be following me lately. The last 3, 4 weeks, this topic keeps coming up. And so I felt like if it's coming up so much for me, maybe it's coming up, or maybe I need to be communicating about this topic to a broader audience. And so this topic is about how our emotions um, play a role in the manifestation of disease in the body. This isn't a new concept, but it's definitely not a mainstream concept. And I think it's kind of like the least approached. Not too many people I know want to sign up to dig through their life and find all those really painful moments and work to release that trauma from the body. But it is absolutely imperative. Um, I work with people that have inflammatory bowel disease, chronic digestive issues, and when I got really curious about how kind of the rest of the world and a lot of indigenous cultures view different parts of the body and disease and what the tie is, the kind of the mind-body connection. And I thought it was super interesting because when I looked at an indigenous culture in Mexico that was speaking to ulcerative colitis or inflammatory bowel disease, really, their view on it was, it seemed to be just really resonate with me and be spot on. And basically, there's ulcerations in the digestive tract when you have inflammatory bowel disease. And that is a sign of aggravation. And they believe that that aggravation that's creating the inflammation in the body comes from an inability to speak your truth, speak your own mind, to release yourself from being a people pleaser, always saying yes, 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 even though maybe you don't have time or um, a desire to do whatever it is that you just said yes to. And I thought that was so amazing because that's exactly how I've spent most of my life, just in agreement, even when I didn't agree, and really, really repressing my viewpoint. And maybe that's connected to a sense of not being worthy enough to speak my mind. Who knows? That we could go down that rabbit hole if we wanted to, but that would take way too long. So what I want to say is that um, as a nutritionist, one of the things that I do is I put together protocols, very personalized protocols for people that help to manipulate the microbiome or all of those bacteria to try to get people well using food and supplements. But we talk a lot about stress and we talk a lot about sleep. And one of the topics that I always bring up is the emotional aspect of things. Like, so is there a triggering event that happened in your life? And trauma can look like so many different things. It's about perception. And so if, somebody might have been traumatized, and rightfully so, by having a head-on collision that they survived. Somebody might be traumatized by the loss of a loved one. Somebody might have been traumatized because they were adopted. There's so many different things that could transpire in somebody's life that they could perceive as traumatic, very painful, and that emotion sitting in the body over many, many years absolutely contributes to disease. So the idea is that, it's never too late to get that energy out of the body, to release those emotions, to practice love and forgiveness and acceptance. And dare I even say, finding the gift in those difficult moments. So I'm not a psychiatrist, I'm not a therapist, I'm not an energy worker, but what I do know, and I think because I've personally experienced it, is that you can put so much work into so many different modalities to try to get well. And if you're not going into that dark space, then where all of those memories that we hold are found that we don't want to look at, then you are probably not going to fully heal and thrive. Some people absolutely, we all have our own ways of dealing with things. And so you don't have to do something, nobody has to do the same thing to get the result. Whatever resonates with you, to pull that energy, that negativity out of the body and really fill the body with, I mean, just love, to be honest with you, love and forgiveness of yourself, forgiveness of others. Super, super, super powerful. And some of the things that benefit in the body from doing this is, you have lower blood pressure, you're able to breathe deeper. And can you even imagine, like, most of us live such hectic, busy lives, and so many things are going on that we actually do not take enough deep breaths throughout the day. And if you actually think about that, that means we're not getting the amount of oxygen in our bodies that is really needed to feel really, really well. Every single cell in our body needs oxygen. And if we're taking these shallow breaths all the time, which is very, very normal for somebody that has experienced stress or trauma, it's fear. Fear is a big one. Anxiety and panic attacks, they cause us to close up the diaphragm, shallow breathe. I needed to take a deep breath. And those things resolve. There's practices that you can use to be able to get that diaphragm open back up again too, in conjunction with all of the things that might come up too. In fact, it's probably best if you have a practice of deep breathing while you're going through that kind of traumatic, looking at the events that have transpired that are hard to see. So the kind of the big one for me, the benefit of releasing that energy from the body is that it really boosts our immune system. So our immune systems are literally suppressed when that negative energy sits in our body. And can you imagine what that means over the course of many years? I mean, that's kind of the big piece of disease. So I'm going to wrap it up. I know I go on and on and on about things. I'm just super, super, super inspired by this thought, and especially this video. So please, please, please take a look at this video, because what's important about this video is that, I mean, he's this brilliant, brilliant mind. He's studied so many different things, but his delivery is in a very understandable, layman's term way that I hope really plants a seed in anyone watching that feels like they want to give up on their healing journey because they've done everything right. They've changed their food, they started exercising, they try to get better sleep, they're trying to manage their stress, everything you can imagine, and then they're not moving the needle to the degree that they had hoped. And I would start here in this kind of emotional space. It's hard, but it's 100% worth it. And it can actually be the catalyst for you to reach your goal. That's how powerful I think it is. So I hope you enjoy the video below, and I'd love to hear what you have to say about it if you want to share. So for now, everybody be well.